lots of things you can do. You can do the diets out there. You can do the weight loss programs. You could do stomach stapling, whatever it is you're going to be doing, thinking that's going to fix your diabetes. And in many cases, in most cases, it's not going to fix it. How do I know this? Because we see patients come into our office that have done those things. So if you're looking for this miracle weight loss program, this miracle diet that's going to reverse your diabetes by going into your doctor to have them do a surgery to make your stomach smaller or put a sleeve in there to constrict everything so you don't want to eat as much and thinking that's going to fix your problem, those are not going to fix your problems. I hate to burst your bubble, but that's not going to be the issue. So as I said in the first portion, you have to commit. The second topic is you have to find out why you have diabetes. And you may be saying, oh, it's because my doctor told me it's because of my diet, or I need to take this medication. Well, it's not that simple. There's more to it than that. And so this is why number 3 is so important. So we have number 1, which is you have to commit. We have number 2, is you have to find out what is going on. And what I mean by what is going on, you have to comprehensively test. You have to dig deep and understand the different mechanisms that is really going on that is contributing to your inability to regulate blood sugar. Did you know that there are 6 organs involved in blood sugar regulation? And not even the organs, there's other systems that are also heavily involved as well that many people aren't even discussing. 6 organs. Most people think, oh, it's just the pancreas. Maybe some of you know about the liver as well. But there are many, many organs and systems that are involved in blood sugar regulation. So we have to think more broadly. We have to think 35,000 feet above the air. You have to know what is causing your diabetes. And I don't just mean, oh, I have high blood sugar. I mean, what are the underlying problems that are contributing to your inability to regulate your blood sugar every single day? That has to be discovered. So number 1, commitments. Number 2, you have to understand what is going on. What is the underlying problem? Number 3 is the most important beyond that, because if you made the commitment, and if you're still watching this video, hopefully you're in that commitment. If you're now at the choice, I have to find out what's going on. Well, number 3 is just as important, if not the most important. You have to find a doctor that can help you. Now, many of you right now may be seeing your medical doctors or other types of healthcare practitioners that are helping you manage your diabetes, and that's fantastic. Keep on doing that, as well as finding another doctor who can help you to really take care of the underlying problem, to help you get to your goals, whatever that might be, to become non-diabetic, to reduce or reverse the chances of an early death or these complications that are associated with diabetes, and of course, potentially getting off your medications. If that's what you're looking for, you have to find the right doctor that's going to help you with that ability to do that for you. Just going to your primary care physician or your healthcare practitioners that are managing your diabetes are never going to get you to that point. It's not going to happen. You have to find a doctor that really truly understands these underlying mechanisms, how to properly analyze, how to properly test, how to properly put the proper protocols together, because guess what? Every single diabetic is different. Their underlying mechanisms, their problems, their conditions they're dealing with, their areas that are broken are not going to be the same from one diabetic to the next. You have to understand that for yourself. If you think that the same thing you're going to be doing is the same thing your husband or your wife or your kids or your sister or brother are going to be doing as well, think again. Everything has to be customized. We have to look at every single patient individually. But if you go into your doctor's office today and you look around the room and you ask everybody, hey, what are you doing for your diabetes? What are you doing for your diabetes? Guess what they'd all say? Pretty much the same medication, right? They may have a different name or because it's a different manufacturer or what have you, but essentially they're doing the same treatments, right? Let's talk about that. Change your diet, exercise, lose weight, take this medication. That's pretty much a treatment of diabetes throughout, which basically means that every single person is getting the same diagnosis, every single person is getting the same protocols, the same type of diet, the same recommendations for losing weight, across the board exercise, fill in the blank. If those things worked, those things were truly the cure, if you will, for diabetes, then why do we still have such a huge amount of diabetics in this country? Why are people being diagnosed every single day? And someone may say, well, it's because of the way they eat, it's because of the food. Absolutely, because they haven't committed. They haven't committed to themselves, they haven't committed to their health, and that to take care of themselves. So you have to find the right type of doctor who's gonna ask the right questions, who's gonna understand what you're going through, to run the right type of testing, to do the proper analysis, to then come up with the customized plan of action to help you achieve your goals and what you want to do. But not only that, help you put together the proper recommendations of what you should be doing for the rest of your life. Remember, the commitment happens not just now, but for the rest of your life. If you're not ready to make that commitment, if you don't think this is serious enough, then this is not for you. And it's totally understandable because not everyone is ready for this. Most people want to eat what they want to eat. They want to take that little pill or inject themselves every single day and say, I've done everything I'm supposed to be doing. I'm good. I'm happy. I'm going to live this lifestyle the way that it is. Until that dramatic event happens. Until they have that heart attack with multiple occluded arteries. Until they have that neuropathy and the doctor says, hey, we've got to amputate your foot. Until they say, uh-oh, the next 30 days, if this doesn't change, you're going into dialysis or what have you. See, we have a tendency to think as human beings that we don't have a problem going on until it's severe, until it's really bad, until a dramatic event happens. Well, diabetes is called the silent killer for a reason, because it comes up out of nowhere and boom, it takes you out of commission. See, I meet with many people on a weekly basis that are dealing with diabetes that feel good. And they think they're healthy. Even though they're taking 5, 6, 10, 12 different medications every single day, they think they're healthy because they feel good. And they're comparing themselves to that person who's down the road that has already lost a limb, who's already had multiple heart attacks or a stroke or whatever type of underlying condition or complication to the diabetic condition. But if you truly think about it, the only difference between that person down the road and the person sitting in front of me who's not having symptoms is the symptoms. The disease is the same. The condition is the same. The risk factors are the same. Just because you're not feeling symptoms now doesn't mean they're not going to happen tomorrow or the next day. So taking action is the first step in getting yourself to getting better, to helping your condition, to getting yourself where you may be able to get, like so many other patients in our practice, non-diabetic. And yes, it is absolutely possible. I see it all the time. We rarely see a patient fail. So these 3 topics are massively important for you to make that step, that leap to that getting healthy and getting your life back again, and not being at the mercy of a drug or an injection, or I wonder what this is going to do to my blood sugars today or tomorrow when I wake up in the morning. The first step, commitment. You have to commit to yourself and to your family, to your kids, whoever else, whatever it's going to take, commitment to make a lifestyle, lifelong change. That has to happen. Number 2, you have to find out exactly what is going on, being tested properly, understand exactly what the areas are that are not working properly, that is contributing to your inability to regulate your blood sugar. Number 3 is you have to find the right doctor, the doctor that's going to help you. Not only someone you're going to resonate with, right? Not only someone you're going to like and you know you can work with, but someone who has the information, the education, the knowledge, the ability to come up with the right action steps. Take that information from testing, disseminate that information, understand what's going on, put the right protocols together for you, a customized plan that's going to help you not only get you to your goals, whatever that might be, but also help you to a point you can do it for the rest of your life. If you're in the mindset thinking, oh, I'll just do this for a little while and see how this works, that's not how diabetes works. That's not how health works. It has to be something you commit to doing every single day, constantly, every single day. Not, of course, you're going to have hiccups along the way and things may change along the way, but a majority of the time you're focused on your health, you're focused on your ability to function optimally. Listen, as I mentioned in my previous videos, I'm doing these videos because I care about my community, I care about people, and I care about your health and what you should be doing for yourself. We are at a crazy times where we have no idea what's going to be happening. But one thing we do have control over is our health and the things we do to ourselves and how we can help ourselves. There is no time better to making a commitment and change in your life than now. right? So if these videos are helpful for you, which I hope they are, please comment below and let me know, you know, if they're helpful, if you like them, if there's something more you want me to talk about. I'm here first primary as an educator or a teacher, which is what I believe a doctor is.